A lot of us here will know about Karen's work. Karen is a public health physician and an associate professor at the University of Canterbury in New Zealand, with over 2 decades of experience working with nonprofits and low-income communities in India and New Zealand. And most of us will know her from her work with Buraans, a very well-known mental health organization doing work with the community in the Doon Valley in Uttarakhand. And I think Burans stands as an exemplar of what really meaningful co-production and participatory work could look like in communities. And without further ado, I'm going to hand over to Kaaren to lead this peer learning session on cross-sectoral programming and lived experience. Thank you, Kaaren.
So thank you so much. And I'm aware that lots of people have been sitting a long time. So I wonder if we, just before we start, do you want to just stand up, do a circle and a sadhana? Okay, that's great. Sit back down again and we'll try to get going. So I'm going to talk about our experience in Buraans, working in learning how to co-produce and work with people with lived experience. I'm going to cover 3 things, a very quick introduction to Buraans and where we're working. And Buraans means rhododendron flower, and they are flowers that are generous. They spread right across the whole of Uttarakhand's hillsides in the spring, and we thought that would be a great way to think about mental health. I'm going to talk about how we started trying to learn to do more participatory approaches, and talk about quite a lot of ways we did this badly, because it's easy to keep pushing yourself to the top. And then to finish up with, I thought I'd share some ideas we're developing, which we'd love to develop more with the IMHA, with all of us, to think about what are some ways to help us all get better at doing this. So Buraans, we started 11 years ago. We're focusing on 2 areas. We funded with Mariwala Health Initiative, working in rural Uttarakhand, and then also working in a lot of the busties in Dehradun with a range of funders. We try to co-design with experts by experience. That's our focus today. We don't have a team who are mental health professionals. 50 out of 52 people have had Hindi medium education. Our focus is working with resources in communities that are going to stay there for the long run. We try to also think and notice and document well. When we started, we noticed there's almost no evidence base around how to address mental health in communities in Hindi-speaking India. And so we thought we'll just contain ourselves. There's 700 million Hindi-speaking Banjatic plains, so we'll just focus on that place. So just a few things that we've been able to be involved in. We've done a lot of working directly in communities with lay counsellors supporting people, over 6,000 people with psychosocial disability. We've done a lot of work with young people in schools, and I didn't jump up this morning. I've got my colleague here, Prerna, but we've done a lot of work in youth resilience in schools and delivering that right across a lot of Sarkari schools around the state. And then we're also active in the State Mental Health Authority, which is a cool place to try and influence the system. We've written over 20 peer-reviewed publications, and a few of those are here. But we've also had been keen to just start looking at building capacity regionally, and it was wonderful last year to run the Humare Anubhav Hamari Aawaaz with IMHA and a bunch of people, some of who are here today. I'm wanting to focus today on our project that we did in 2017, working with Sumit Jain as well from the University of Edinburgh. And we were trying to think about developing a tool for recovery that was fit for a North Indian urban setting. And Rakal Gaitonde, some people will know him, he's a professor in Trivandrum, and we asked if he would be our guide and mentor. He's done a lot of work in participatory approaches. And I really rate, if this is new to you, it's really great to find someone who's happy to guide you and help you shape it, because it's so easy to trample when we have more hierarchy and more power. So it's really good to have someone try to keep us honest. This tool, we were trying to say, what does recovery look like in North India for people who live here? And our focus was women and busties. And we wanted to understand this using, and we also, an objective was to build our own skills and participation. We just in the last session, we just had Vijay and others talking about the idea of recovery, which is the idea that we're not looking for cure, which is a really biomedical concept, but we're looking at how do we thrive carrying with us some of our own experiences and recognizing they'll probably stick with us. The reasons why we wanted to make something fit for purpose in India was that we had been trying to use some other slides, some other resources from England. One was Recovery Star. It had nothing about having faith or spirituality, and that's really core to so many people here. It had formats that didn't work for a lot of the Muslim people in the busties, where you had to post up pictures, and we just knew that there was so much more local context that we could do a better job of if we made our own resource. This is how we started off. We wanted an expert by experience group, and we wanted it to be people who had their own experience, who lived in busties, and most of the women we were working with were not literate. One of the things I think I've seen often is that lived experience experts are often the people who are most articulate and who have had a lot of education, because they get to speak at places like this, which is more of a Angrej bolne wale vyakti. So instead we said, well, let's stick with people. It's going to be challenging for us to do this, but let's stick with people who are living in busties, who have going to have a lot more understanding of that context. One of the biggest things at the beginning was that we needed to just develop a level of trust and safety. So we had 4 or 5 meetings, and Brenda, who's here, was one of the people convening. We just told our stories. How are we here? What's our lives about? What do our kids do? And so it was really important before we even got to the start line that we had a high level of trust. We had to be really creative, and I think this was actually really great for us, because when you have people who are really literate, we're used to writing texts, and instead we had to say, okay, let's all go outside and find a symbol of something that feels to us like the concept of equity. And one woman came in with a daisy with the petals all around the outside. Someone else came in with a bicycle wheel. And it was really great just to sort of help us think about things. So we did scoring using Rajma beans. We drew pictures. And it still had lots of challenges, but we were able to find ways to do it that was participatory, that worked for people who were not literate. One of the things that was really important was building a sense of expertise, and so most of the people in the group were like, "हम लोग क्या पता है? आप लोग हमसे बहुत ज़्यादा चीज़ पता है." And they were saying, "All I know is to get the bread and the water and send my children to school." And then we started trying to draw some of our ideas of the recovery tool as pictures. And that was when the women really, really suddenly realized how much they knew, because it was a young middle-class Hindu girl had drawn the pictures, and she didn't put bindi on, and she didn't put bangles on the women, and she had the children going to school without and their father was not carrying the school bag. And they're like, "ये बिल्कुल बेकार है, इससे क्यों बनाया है?" And then they really helped us, and they could straight away see all the problems. And then we're like, this is why we need you guys, because we'll draw pictures that are completely irrelevant, and you guys know what's right. And so it was really helpful, because that was when they started realizing that we were actually complete twits and that they knew so much more than us. So that in this particular thing, which was great. Just for your interest, these were the 8 domains of recovery that they came up with, and this is what dikhona, this is what thriving well with mental health conditions looks like in that busty. And I found it really interesting that the 4 of them are linked to collective relationships. So being an active family member, being a friend, dost hona, samudaya ke sakriya sadasya hona. So I think it was really important, because that's such a core thing to to life in a community in India. I wanted to really reflect on ways that what we did badly, because actually, although we did make a genuine effort, there was still lots of things that we did poorly. One of them was that the funder wanted everything done, form the group, make the recovery tool, and have the whole thing done and dusted in 12 months. And we agreed to that. But I would say that tight timelines are an enemy of good quality participation. And if you're trying to really push it along, we didn't give time for the lived experience group to really engage well. And so I would say that was our bad. We should have recognized that wasn't going to be a good quality product. We would often set up the agenda of the meetings and we've got to get this by this time, and we set up kind of our Gantt chart or our timelines without sitting down and actually none of us really knew what was feasible, but we didn't do that collaboratively. And some things that we did do well was, for example, we held the meetings at a place and time that suited women. And this is a picture of example of someone turning up to the meeting saying, I've got both my kids with me, sorry. And so then we had to get a health worker to come and play with the kids while she joined in. So trying to recognize all the other things they had going on. One of the really big things I've got there is we were looking for outputs. We wanted them to contribute to our focus when they needed input. And so, a woman came in and said, I've just been beaten up by my husband. He drank so much last night. How on earth do I care about your recovery tool? And our group had to just completely pivot, say, let's cancel today's discussion. Let's listen to what's happening for you and how can we support you? Because we've become a group, a caring community. And it wasn't just you're here to do work for us. And it's in a setting where there's almost no mental health care. And so we really needed to say, how do we care for the people in this group in this kind of a setting? So the final, there's actually so many ways we did this. We could have done this a lot better. But one that I felt particularly embarrassed about was I had found a conference talking about recovery in England. And so I wrote an abstract, sent it off, and it got accepted. And then I suddenly thought, I just had no right to do that, because this was something we had developed together, and I'm writing the abstract and engaging in this world of academia, which is of no interest to this group, and I didn't get their permission. So I went back really kind of sheepishly and said, look, I'm really sorry, but we've been accepted for this conference, but I will endeavour to raise funds so we can go together, so we can present together. And the women in the group they just laughed, and they're like, look, we do not. Do you think we can leave our children? Can we leave our dishes for such a long time? You go off, you do your conference, but don't make this mistake again. So it's okay. So yeah, there's lots of things we really, I would say it wasn't really a co-produced tool. It was a well-intentioned collaboration which had some co-production elements, perhaps. I think that the recognizing, which is something Vijay just talked about, but there's so much hierarchy. It's throughout life in urban India. And so, recognizing that if someone has had 15 years of education and someone has had 0, there's just so many challenges to trying to work together, but really respecting each other's expertise was the key to that. I think some of the deference and patron culture thing was quite challenging. So people were like, Hanji, aap batao, and we were trying to say, let's cut this whole G thing, let's cut madam, let's cut sir, let's just use each other's names. But it was really hard for people to do that. But even talking about that, they appreciated. So just really briefly, I thought that particular project, when it wound up, they said, oh, you know what, we really loved being part of it, but we've got quite a lot of other stuff going on. But we have continued in Buraans to have an experts by experience group. So we meet 2 to 3 times a year. We've got one group in Dehradun and one in Uttarakhand district. We try to do the agenda setting together. And so the biggest thing is if there's new funding proposal, or we're trying to set up our program priorities, is getting some ranking and priority setting. We recognise that they're experts, and this was just mentioned, but we believe that they should therefore be paid. They've got expertise that we need to do a good job, so they get paid. One other thing that we felt like is really important is kind of capacity building, taking them on exposure visits. They've come to Dehradun and met the district level disabled persons organisations. They've actually become, now whenever we're going to see the chief medical officer, we'll have 5 or 8, as many as we can fit in the Jeep, will come with us to talk about the lack of access to medicines. And so they've become really part of our kind of advocacy team as well. I guess the other thing that we, just sort of illustrating what Vijay was talking about, is moving beyond just designing your health programs or co-delivering it to saying, where is lived experience participation in your governance? Where is it in your budget holding and your decision making? And so in our World Mental Health Day program, which is coming up next week, the Expert by Experience group they've got the budget. They'll be running the whole project, the whole delivery of it, and we just said, just tell us what you're going to do and we'll turn up. So we're really trying to move to a much higher level of decision making and budget holding in some aspects. Yeah, and so really important learnings. I've covered quite a few of these, and so I'll keep moving, but is really just taking time to make, when we have, we've got 2 of the Expert by Experience group in our team governance. And so we then have to run all of our meetings in Hindi because we obviously that participation isn't meaningful unless it's in the language everyone understands. We've had to do quite some training. What is governance? What is operations? And how do we separate those? When we talked about remuneration, we've discussed, what do you guys think? What do you think's a fair rate? Rather than us being the decision makers, we're trying to say, let's co-design all those aspects. And it's and yet also trying to be respectful, like not necessarily saying that we share all of the budget of the program, but I guess one of the things that I would hope would be the next step would be for us to employ someone as a lived experience advisor, and that their actual full-time role is as a lived experience advisor, and then they're sort of there every day. So the last section of my presentation, which I'll try to trot through, because I know we can hear that chai tinkling on the cups outside. But it's building off this paper that we wrote, and I acknowledge Pooja and Minal and Sumit, Rochelle and Kakul, who all joined in with this. But we were saying, how do we make sure that we're co-producing knowledge well? And we thought that something, rather than a checklist, is asking ourselves questions. So I shared one of these at the IMHA convening, but we've expanded it a little bit, and we'd really love to co-develop this further with IMHA, with other team people who are part of the Alliance. So I'm just going to talk through 8 questions that we've drafted, but we'd really love to get your feedback, because we think it could be a useful kind of way for us all to get better at lived experience participation. The first slide is really around how do we start well, and what's the scope of lived experience participation that we're looking for. And so Rochelle Burgess, who's a global mental health researcher who I really like working with, has sort of talked about you've got to get to ground zero. So even before you start, you've got to have meaningful relationships with people with lived experience. And then sort of say, well, what are we up for? Maybe it's too much to think about how we have lived experience participation and governance of our organization, but could we say we'll try and have it in the design and delivery of our programs? Let's start with that, and then let's, once we've got that happening in a meaningful, authentic way, let's keep going. So second question, if we go to the next slide, is who do we include? What is the lived experience we want to represent? And I guess we try to go for a mirror on society. We say, well, if we're working with with a community that's 45% Muslim, and nearly all of the people we're working with are women who've got kids, and they're mostly in the age of 20 to 50, then we need to focus on having at least half of our lived experience organization should be women with kids who are at school. But we want to also make sure that we represent particularly the voices that are typically most quiet. So I think people with lower incomes and at the same time, I think there's a risk of if you have all people with really limited education, a lot of them are not very politicized, and they will often feel tempted to say hanji hanji wo theek lagta hai ha badhiya badhiya. And so it's actually hard to get really someone who's brave enough to push back. And so that's something that we really want to do, is to sort of politicize and expand the voice. But also what was really, really helpful has been to have people in our team who have got lived experience, who are more educated and articulate, saying, I don't agree with you, Kaaren. You are trying to dominate. Can you sit down and we're going to explain it to you? And I'm like, okay. And so it's really great to have some people who are a bit feisty and who perhaps can lead by example. Let's go to question 3. This is, again, this is all about before you get to the start line, how do we do it well? And so the next one is how are we proposing to start? Have we agreed on how we're going to work? And so I suggest writing your terms of reference. How often are we meeting? Where are we meeting? When? What are we going to discuss? Who's going to facilitate? What do we want out of it? We want it to work for people with lived experience. So all of those things, it would be something that you co-design before you even start your regular meetings. Next question. This is again more processes for participation. Are we speaking in Hindi or English? How do we, if we're speaking in, how do we make concepts really accessible and easy? How do we use timelines that everyone feels able to work with? And there's a little comment from Rimjim, who is one of the people in our group, who said, for the first 4 meetings, I couldn't talk in front of everything because I thought anything I say, I'll embarrass myself. I'm illiterate, and how do I know what to say? And so we really just didn't have typically we don't have high expectations for the first 5 meetings, let's say. You really have to have quite a low bar because you're really just trying to get voice and relationship. So on to question 5. I'll just keep moving. Oh, numbering went out the window, but never mind. In our setting where there's very little mental health care, the group has to also care for each other. And so how do we do this, and how do we offer support? And we've got a quote there from a way that a whole group supported a woman when she was having trouble. Question 6, hopefully, okay, this is just all out of order, sorry about that. Acknowledging expertise and remuneration, and I've discussed that, but that's really important. But also, how do we offer hospitality? Do we make the transport available? When we've had the lived experience group came from Uttarakhand to Dehradun, they all stayed in a guest house and had their food and lodgings, and it felt like a really fun gumne for them. Next one. How do we evaluate our processes, and how do we have some kind of critical reflexivity on how we're working? Do we build that into our design? Do we plan every 3rd meeting to talk about how's this going? Are you guys happy? And this is an example of one of our health workers talking to a group of women, and I wouldn't say that was modeling great process. She's standing up, they're all sitting down, she's like dantna, wagging her finger, they're all nodding. So this isn't how to do it. Next slide. And so this is the last one, is really thinking, how do we make sure our co-design processes are sustainable, they're building strength, they're building our capacity, and how do we make sure that it continues to be a growing learning journey? So those are 8 questions, with the numbering a little bit out of sync there, but we're keen to discuss them more. I'm not sure how much time we're going to have today because we're running a bit late, but something I hope we can open up in more conversations ahead. So we'll just go to the last slide or 2, just summarizing. Key to all of this is being humble, prioritizing relationships, being reflexive and transparent, noticing power relations. And I think a few of us might have seen this idea of equality versus equity, but obviously we've got to put in the resources that people need to genuinely participate. So next slide. These are some of the people who have trusted us to do work, and we're really, really thankful for all of them. and really thankful for IMHA and the chance to be here. And this is just the last slide is just saying thank you, and please be in touch if you're interested to converse or talk more. So thanks.